Hello and welcome to Covered. This is COVID Vaccine Equity Research Dialogues from the Leonard Davis Institute at the University of Pennsylvania. I'm Allison Buttenheim, here with my Penn colleague, Dr. Harold Schmidt. And our guest today is Dr. Helene Gayle, who's president and CEO of the Chicago Community Trust. She has had an incredible career in public service and public health and global health. She was the CEO of CARE and spent decades at the CDC and the Bill and Melinda Gates Foundation on tackling the HIV/AIDS pandemic and many other global health issues. I also want to point out she was recently awarded a Chicago Mayor's Medal of Honor, recognizing her many contributions to pandemic response. Last year, I had the great pleasure of getting to know Helene when she served as co-chair along with Bill Foege for the National Academy's Committee on the Equitable Allocation of the Vaccine for the Novel Coronavirus, which I also got to serve on. And in that capacity and in her leadership at the Chicago Trust and her incredible career in public and community service and in health, we've asked her to come today and help us review where we are with the vaccine rollout, coming up on President Biden's July 4th deadline to have 70% of the population vaccinated. Dr. Gayle, welcome and thanks for joining us.
Thank you. It's my pleasure. Great to be with both you and Harold.
Thanks. As we look towards this July 4th goal that President Biden has set, how do you think we should evaluate progress, not just towards that level, but towards our sort of equitable pursuit of that goal?
Well, I think it's clearly a mixed bag. And first of all, I want to commend President Biden for setting a goal, because I think we all know that if we don't set a target and have something to shoot for, we oftentimes don't get very far. And so the fact that we had this target, I think, has pushed us to do more than we would have otherwise. That said, given that we started this as a very decentralized effort in the very beginning, it's taken a while to really think of this as a national pandemic and put in place the things that really support a more unified approach to it. So, today we have some states, particularly states in the Northeast, who have done tremendously well. We have cities that have exceeded the targets, but we also know that there are other states that have a very low rate. And there's real pockets where there are almost, a very limited number of people who have access to the vaccine. So we know that we need to do a much better job across the country, because it doesn't matter that I live in Connecticut and have a high vaccination rate there among the population, if in fact in Mississippi or Alabama it's low. Because, we are one nation, we travel, this spreads. And until we really think of this as a national epidemic and, and then obviously a global pandemic, none of us is safe until all of us is safe. And so, I think that's where we are. The second part of your question was, how are we doing in terms of equity? And again, I think that, that is, it remains to be seen in different populations and different cities. Here in Chicago, there are parts of our city, particularly in our downtown areas, where over 90% of people have had at least one vaccine. You go 5 miles away in some of our particularly African-American populations, and less than 27% of people have had access. And so, these are real concerns to think about. On one hand, over 50% white population, totally vaccinated, under 30% Black population. We've got to do better than that.
In the National Academy's report, we made a point of saying that there should be prioritization of supply and allocation using something like the Social Vulnerability Index. Different jurisdictions did that to different degrees, lots of interesting case studies. Do you think where we are now with the supply and demand dynamic looking really different from when they did in December, January, February, is there still a role for using some kind of disadvantage index or other metric to drive allocation, to drive promotion, to drive other efforts for the rollout? Is there still a role for something like the SVI?
Yes, I think it's critical. And I guess the other part of that is that it isn't surprising that the, kind of quote, low-hanging fruit, those who were most likely to get it from the very beginning anyway, have already gotten it. Now we have populations that, it's going to be tougher. So I think those intensive focus programs on the geographies where people are at greatest risk of the disease or of severe consequences have to be the places where we continue to figure out what is it going to take to increase vaccine uptake.
Well, maybe building on that, what is it going to take question, let me ask you about one specific initiative that seems to have cropped up a lot in the past few weeks, which are the sweepstakes and the lotteries and the other forms of incentives. We just launched our sweepstakes in Philadelphia a week or so ago. Would love your take generally on that, but also do you have concerns, or do you think, again, from an equity standpoint, that those strategies are going to be effective?
From an equity standpoint, I worry that, again, those who have the most ability to access, get in a car and get to the places where the sweepstakes are taking place are the ones who are probably the most likely to access them. And they are also often the populations where just a little bit of extra push will get them there. And so I worry about whether it's going to reach populations who are more resistant and who have lesser access. Are we putting in place not just fun things, but are we putting in place some of the things that people really need? Free transportation coupons, subsidized childcare for a day. I think we have to think about what are the things that are really keeping people from getting vaccinated and then respond to those.
What is your sense, just one quick follow-up on that question, on the opportunity cost? So in some sense that it seems these lotteries are ongoing anyway, and it's just shifted who has a chance at winning now. In other cases, it seems like funds have actually been committed anew. And the question then arises, well, what if I allocated these funds to community health workers instead, right? I would love to see a trial that compared these two initiatives rather than said, well, this looks promising, let's do it. To me, there's a question of opportunity costs of those funds. How would you view that question?
I think of what's the appropriateness of this? Is this the way we want our population to access important public health interventions, that we bribe them to get a vaccine?
Yeah, it's not just about needles in arms, right? Exactly.
Yeah.
That's a bigger picture.
Yeah.
And in a way, you've already answered the next question, Alison, I thought we'd ask you, which is that in the preface of the Academy's report, you and Bill Figge wrote, quote, "In embarking on our task, the committee started with equity," unquote, and then considered the science, transmission, etc. So we wondered if you could just unfold that reasoning a little more and comment on whether you feel that this spirit has continued in how planners then planned the vaccine allocation at the jurisdiction level.
One of the reasons I was so proud to be part of this committee is that it's the only time that I can think of in my public health history that equity was front and center. It was the cornerstone. It was our foundation. It was our bedrock. And everything that we did embedded the notion of equity in it. I think there are many places that would not have thought about measuring how well we're doing from an equity standpoint, collecting the kind of data that allow us to know whether or not we're getting to communities at greatest risk. So I just think the fact that equity was front and center from the very beginning was landmark. It's different, and I hope it speaks to hopefully a trend in the way that we think about public health and embedding equity as part of it. We also squarely tried to lean into the issue that this was about racism to a large degree, and making sure that as we developed our framework, we took into consideration the parts of one's lives that were impacted by a racialized system.
I think that's an amazing point. And I think we maybe underestimated the challenge that jurisdictions would have in implementing that because of the intersectionality you just mentioned.
Right.
I saw a little bit of that up close with Philadelphia, since we're our own CDC jurisdiction for vaccine. And questions like, what are the age bands And, because there are different age distributions of different race ethnic groups and different risks, age-based risks by race ethnicity, that was challenging. And then as we, decided what high-risk occupations were, those occupations have very racialized components in Philadelphia. It was really challenging to keep applying criteria that weren't specifically race-based, but with a racial equity lens. It was hard.
Right. Yeah.
And on that, so the vehicle or central and novel vehicle, of course, that's included in the report is to use something like a disadvantage index to address this really difficult intersectionality that Allison also just flagged again, right? Now, as you know, we did a review to look at how jurisdiction planners use this and found that the majority of states did actually adopt a disadvantage index. Did that surprise you? Did you expect that? This really rapid and widespread uptake of disadvantage indices that we have seen?
Well, one of the reasons we used the social vulnerability index from CDC was that it was something that jurisdictions were already comfortable with and had used previously. And so, there was a lot of discussion around, should we use another index? There are some COVID specific index that build on the social vulnerability index, but we thought that as a general rule, using something that people were familiar with would in fact lead to greater uptake, quicker uptake. And so, we're pleased to see that validated what our thinking was.
As we look ahead to the next, say, 6 months, maybe between here and the end of 2021, what advice would you have for, Biden administration and CDC on down to local jurisdictions? Each million doses that we get in arms now is harder than like the first 50 million or 100 million. Where should energy and resources go?
Yeah, I guess energies and resources, I guess I would say stay the course. It would be very easy to stop doing some of the geographically focused areas and say, let's just, we got plenty of vaccine, there are plenty of sites, people can come get them. I think we have to stay the course until we really do see some of that gap decreasing. I think we can't give up. We've got to continue to do what it takes to reduce that gap and to make sure we're getting it to the people who truly are at greatest risk.
Well, and it's particularly labor intensive for the trusted messengers like yourself. We have an uneven distribution of that labor for those repeated conversations that people need to hear from people they know and trust. So.
Yeah. But I'm encouraged, for instance, Rockefeller Foundation is funding, series of partners around the country to do that work. And so, that's what it's going to take. It's going to take everyone stepping up, putting the resources in, and, being cognizant of that. I also, you started to touch on the global. I think that we're now turning our focus on global equity, which I think we have to do because, again, we can't end this pandemic unless we're thinking about, the rest of the world as well. And I think we as the United States can walk and chew gum at the same time. We don't have to wait until everyone is vaccinated in the United States before we're generous about the rest of the world. We can do both.
I think that's a perfect place for us to wrap up. Our thanks to Dr. Helene Gayle, President and CEO of the Chicago Trust, for joining us today as our guest. Along with Harold Schmidt, I'm Allison Buttenheim from the Leonard Davis Institute at the University of Pennsylvania. And this was our last episode of Covered COVID Vaccine Equity Research Dialogues. Thanks for joining us.